Schizophrenia and transcranial direct current stimulation. Schizophrenia is a neuropsychiatric disorder and chronic debilitating mental illness ranked among the top 10 disabling disorders. 21 million people are currently diagnosed with schizophrenia worldwide. Structural neuroimaging research has given strong evidence that schizophrenia is associated with multiple brain abnormalities that involve cerebral, grey and white matter, brain volume and structure. According to the Diagnostic and Statistical Manual of Mental Disorders, there are negative symptoms, which refers to the absence of normal behaviours related to motivation, interest and expression, cognitive impairment, which occurs in 75 to 80% of patients and often associated with poor daily functioning and quality of life, and positive symptoms, which reflect an excess or a distortion of normal function, such as delusions, disorganised behaviour and hallucinations. Auditory verbal hallucinations are central to the condition, which is the perception of voices without external stimuli and is experienced by about 70% of patients. Treatment for schizophrenia is challenging due to its complexity and currently includes a combination of psychoeducation, psychosocial and rehabilitation treatments for the negative and cognitive symptoms, and antipsychotic medications, which assist with the positive symptoms such as voices. However, 25 to 30% of schizophrenia patients continue to experience voices despite the medication. Given this fact, the past decade has seen an increase in the use of non-pharmaceutical techniques, including non-invasive brain stimulation, which encompasses several techniques including transcranial direct current stimulation, or tDCS. tDCS has attracted significant interest as an add-on treatment for medication-resistant symptoms in schizophrenia. tDCS is a non-invasive, safe procedure delivered by a battery-powered device that provides a low-intensity electrical current of 1 to 2 amps throughout the brain by using 2 electrodes positioned on the scalp. The anode electrode, where a positive charge enters the scalp, is considered to increase excitability of neurons, facilitating depolarization. And the cathode electrode, where the negative charge exits the scalp, is considered to reduce excitability of neurons, inducing hyperpolarization. It is believed tDCS is helpful for many neurological and psychiatric disorders by changing the neural activity in overperforming and underperforming areas of the brain. Further, while the electrical current changes the resting membrane potential, bringing the neuron close to firing stage, an action potential is not triggered. It is believed that persistence of neuromodulation alters the brain structure, causing neuroplasticity changes at the synaptic and network level by altering the synaptic microenvironment, for example, the activity of the receptors, and causing increased ionic permeability and therefore synaptic transmission. Session duration, frequency, and intensity varies between studies and conditions. Research has suggested beneficial effects of tDCS for medication-resistant symptoms of schizophrenia, including negative symptoms, insight, cognitive deficits, catatonia, and auditory verbal hallucinations. Evidence suggests that tDCS for 20 minutes twice a day, with a 3-hour interval over 5 days, is effective to reduce auditory verbal hallucinations. Neuroimaging findings suggest that a person with schizophrenia has a dysfunction in the cortical areas of the brain and hyperactivation in the temporoparietal region. tDCS has successfully been used to stimulate the dysfunctional areas by decreasing activity in the temporoparietal regions to reduce auditory hallucinations, or to increase activity in the frontal regions to increase mood, motivation and cognition. To achieve this effect, a cathode electrode is to be placed over the left temporoparietal junction and the anode over the left dorsolateral prefrontal cortex, which has been successfully used to treat auditory hallucinations for up to 3 months. Further, an anode electrode over the left dorsolateral prefrontal cortex and the cathode electrode contralaterally has also been applied to improve negative symptoms. While there have been promising results, there have also been very mixed results. For example, a review of existing research of 12 tDCS and auditory verbal hallucination studies involving 465 patients found most studies were biased and that it could not be concluded that tDCS is effective for treating auditory verbal hallucinations when comparing results to the sham groups, and suggested that larger, more controlled studies are needed. Further, the effect of tDCS also appears to vary depending on factors such as skull thickness, whether the patient is taking medications, and demographic, methodological and clinical differences, such as stimulation parameters. Research also indicates that neuroimaging studies have shown differences in brain activity during auditory verbal hallucinations, indicating that position of the electrodes may also need to be varied and even targeted by neuroimaging to allow for individual differences in cortical activity. tDCS represents a promising new treatment approach for medication-resistant symptoms of schizophrenia and other major mental disorders. There are appealing characteristics of tDCS, such as the fact that it's non-invasive, is mostly well tolerated, is temporary, and has mild adverse effects. Although sham-controlled trials examining the efficacy of tDCS for auditory verbal hallucinations in schizophrenia has inconsistent findings and warrants larger, more controlled studies. Ideal approaches to operationalizing these treatments is still under development. Lastly, it may help to target brain areas with neuroimaging to account for individual differences in brain activity.